Hi, I'm Shelby, and I'm going to be doing a full head-to-toe assessment on my husband, Eric Shank. So prior to this assessment, we've done a full health history, so he is nice and healthy, no conditions, no medications, no abnormalities of any kind. We've done a mental status examination, so he's alert and oriented, everything checked out good that way. I've checked his height and weight and his vital signs, all within normal limits, and we have completed the assessment of cranial nerve number 2, which is using the Snellen test for his vision. So we're going to go ahead and start. So Eric, while I'm doing this assessment, if anything is tender or painful, let me know. Otherwise, we are going to start with all of your cranial nerves. I'm going to ask you to do a whole bunch of different things, and then when we're done with that, I'm going to start at the top of your head and move my way down your body to your toes. Listening, touching, inspecting with my eyes, and asking you to complete a couple of different things for me, okay? So, starting with cranial nerve number 1, we're going to assess your smell. So will you plug one of your nostrils and tell me what you smell?
Mint.
Okay, now plug the other nostril and tell me what you smell.
Lavender.
Okay, so cranial nerve number 1 is intact. Like I said, number 2 was completed with the Snellen test. His vision is 20/20. Cranial nerves number 3, 4, and 6, I'm going to be assessing your eyes and your pupils. So first off, will you just follow my finger without moving your head? Okay, so eye movement is intact. Will you close your eyes and then open them again? Okay, so eyelid movement is intact. Now, I am going to block the light from one eye to the other. Will you just stare at me? Okay. And other. So I just assessed Perla. The pupils equal, round, reactive to light, and then watch my nose, and then the corner of the room, and then back to my nose, and accommodation is normal as well. Cranial nerves number 5 and 7 are of your facial movements. So can you smile and frown? Okay, what about wrinkle your forehead, raise your eyebrows? Okay, perfect. Puff your cheeks out for me. Okay, beautiful. 5 and 7. 8 is hearing. I don't have the tools here with me to do the official hearing test, but I'm just going to whisper in his ear, make sure that he can understand the word that I'm saying. So, plugging one ear and whispering.
Purple.
Okay.
Banana.
Okay, so hearing is intact. 9, 10, and 12, I'm going to be assessing his mouth at the same time that I'm assessing these cranial nerves with his tongue movement. So stick out your tongue for me. Okay, move it all the way around. Okay, put it in your mouth. Now press on my hand. Okay, and on this side. Perfect. Okay, open your mouth. So with a tongue depressor, I'm going to be inspecting. So his teeth look good, his tongue look good. Oral mucosa look normal. So tonsils as well. Go ahead and open for me. Tonsils, say ah.
Ah.
Okay. If I touch his uvula, I will elicit a gag reflex. So mouth is normal and intact. So that's cranial nerves 9, 10, and 12. And then, and will you swallow for me? So I'm going to have you swallow 2 different times. So first, just to assess your swallowing reflex, and then second, I'm going to be assessing his neck at the same time, just so I can do his thyroid assessment. So swallow again for me one more time. Okay, perfect. And then assessing, so we've done 8, 9, 10, and 12. And then cranial nerve number 11 is shoulder and neck strength. So will you go ahead and push on my hands? Okay. And then push forward on my hand here and to the side. Okay, and then to this side. Okay, so all of your cranial nerves are intact. Now I just want to rapid movement. So can you pat, flipping your hands upside down, clap, down. Now go one hand at a time. Okay, other hand. Okay, what about touching all of your fingers to your thumbs? Finger to nose. Okay. Let's assess. So I would also be able to assess with his facial sensation with sharp and dull if I had one of the instruments there to do it. So now I'm going to start head to toe, and then when I stand, I'll assess your balance at that point. So starting with his head, I'm going to be inspecting for any abnormalities, which I don't see any. Feeling through his hair and on his face, assessing sinuses here. I'm not feeling any abnormalities. Skin is nice and pink. His skin is warm to the touch. Hair has a good normal texture and dispersion is normal. Moving to his ears, no external malformations. I would assess his internal ear if I had the tool, but I would look at his eardrum. It should be pearly gray on his internal ear. And then eyes we've already assessed, but I would check his red reflex as well. Nose, I'm going to assess for any drainage. He didn't report any. I'm looking at the color, turbinates, and it looks like you do not have a deviated septum, so I would be able to see all of that within his nose. Like I said, we've assessed his mouth as well already. Lymph nodes in front of the ear and behind the ear, occipital down here, anterior and posterior here, and then supraclavicular here. So I was not able to feel any lymph nodes, which that is normal. Now assessment of, I'm going to move to your extremities first and then do your thoracic cavity. So I want to test strength. So will you just put your arms down to the side, push up on my hands and now down, and then forearms push up and down. Okay, squeeze my fingers for grip strength. Okay, perfect. Push up on my hands here. With your knees, yep, sorry. And then push out on my hands and in. Okay, up on my hands here with your feet and down. Okay, perfect. Also, I'm inspecting color, temperature. I'm not seeing any edema on any of his extremities. Looking here as well. Okay, assessing for pulses. So I'm going to do radial here, popliteal. I'm sorry, bring your leg forward just a smidge. Okay, and I'm going to do that on both sides, and then dorsal pedis. Normal there. Capillary refill here, and then I would assess it also on his toes, and then reflexes. So using a reflex hammer, I would assess his tricep up here, bicep here, brachioradial here, patellar here, and then Achilles back here. On your thoracic area, I'm going to be listening to heart and lung sounds. So as far as lung sounds go, on the front anterior, I'll be listening on 5 spots on each side, bilateral, kind of follows around the rib cage, and then on the back posterior, follows around the scapula and rib cage as well, and then over here to the sides. So I'm wanting to not hear any crackles, wheezes, any abnormal sounds, just nice clear lung sounds. Also on the neck, I would assess the carotid one at a time, and then listen with the bell of my stethoscope for any bruits. Okay, I'm not feeling or not hearing any bruits. Okay, lungs. Okay, so I'm not going to listen to all of the lung sounds since I've already told you where they're going to be, but I would listen here and then again on the back in all the spots that I've told you, starting high on the back and following all the way down the scapula and through the rib cage to the sides. Lung sound or heart sounds, I'm listening for on the right side, second intercostal space aortic, and then pulmonic on the left side. Then third intercostal space is herbs, fourth is the tricuspid, and fifth midclavicular would be the mitral. Okay, I'm going to have you go ahead and stand up for me now, and I'm going to do an assessment on your back. So, tactile firmness, will you say the word 99?
99.
Okay, I'm just feeling the normal vibrations, nothing out of the ordinary there. For bronchophony, I'm going to have you say the word 99 again while I'm listening. Again, I would do this on all of the spaces. 99.
99.
Okay, what about whisper 1, 2, 3? Okay, and then egophony, will you say E?
E.
Okay, and that sounds like a long E on the whispered pictroloquy. I was not able to hear him whisper the words 1, 2, 3 clearly. Okay, and then while I'm here, while I'm assessing your vertebrae, are you having any tenderness here?
No.
Okay, and then as I tap on your kidneys, any tenderness out of the ordinary there?
No.
Okay, so I just assessed the CVA of his kidneys. So go ahead, turn. So now we're going to assess your balance while I've got you standing. So I want you to knit or heel to shin on both sides. Okay. Okay. Can you stand on one foot? And then the other foot? Okay. Now close your eyes. I'm going to stand in front of him just to hold him in case, or to help in case he falls. So stand on one foot again. And now the other foot. Okay. Now keep your hands to the side, feet down on the floor. I'm going to do a Romberg test. So with your eyes closed, I'm just going to push and see if you lose your balance a little bit. Okay. Good. You passed your Romberg test. Okay. Now, can you walk on your heels? And what about your toes? Now I want you to do a heel to toe walk. I'm assessing for scoliosis here. Okay? And then just turn around and walk back to that chair normal. Okay, so assessing his gait, nice and normal. Go ahead and lay down on the ground for me. Okay, so I'm going to move over to the right side. I'll put this down a smidge for you. Okay, so that I can assess his liver here as well. But before I do anything, I'm inspecting, so it's nice and normal. I'm not seeing any pulsations, nice and flat. I'm going to auscultate bell sounds in all 4 quadrants, as well as with the bell on my stethoscope, I'm listening for any aortic roots. So nothing there. For the sake of time, I'm not going to go through and do all of the bell sound assessments, but in all 4 quadrants, I'm listening for at least 5 or more clicks. That would be normal. 1 to 5 is hypoactive, and none at all would be absent. If I'm not hearing at least 5 clicks, I need to listen for 5 minutes in each quadrant just to make sure, is it hypoactive or is it absent, or is it really normal and it's just, taking longer than normal. So auscultation of all of that. I'm going to percuss for liver and spleen here, and then tender palpation in all 9 quadrants, as well as, and I could percuss here as well if I was concerned in those quadrants, and then so light palpation, deep palpation, and I would be feeling for the edges of this liver and the spleen for any abnormalities. He doesn't have any conditions that would make me concerned that they were enlarged, so I would definitely expect them to be within normal limits there. Will you go ahead and sit back in this chair for me? I have a couple more things for you to do. Okay, so stereognosis is I'm going to put an object in each of your hands. I want you to close your eyes and tell me what that object is, okay? So in this hand, what do you feel?
Earring.
Okay. And in this hand, what do you feel?
Skill.
Okay. Now, I'm going to draw something on your hand, again with your eyes closed. Just tell me what it is that I'm drawing.
S.
Okay.
Y.
Okay. Perfect. Let me just think really quickly that there's not anything else that I missed. Okay. Thank you for letting me do a quick assessment on you.